Hi everybody, my name's Claire Parker. I'm the consultant midwife here at the Rosie. Today we're going to give you a tour of the pool room on delivery unit. So, of course, since coronavirus has come into all of our lives, we're sadly unable to give you tours of the maternity unit. And there's also been a halt to our antenatal classes and our hypnobirthing classes. And we know we really value the importance of being familiar with birthing environments. So, we're going to give you a tour of the pool room. So, if you follow me. So this is our pool room on delivery unit. It's really for people who have, so up here on delivery unit, traditionally this is an area, an intrapartum area for people that do have risk factors, such as higher blood pressure, multiple pregnancies, diabetes, preterm labour, that kind of thing. But we know that there are lower risk women that do have one or two risk factors that mean that ordinarily they would like to use the birth centre, but for one reason or another, they're actually encouraged to have electronic fetal monitoring, or at least be present on delivery unit to maintain the safety for themselves and their babies. So this is why we have created the pool room up here. And you can see we've tried to make it as home from home environment as possible. What we love about the room, what I love about the room in particular, is that the bed isn't the focal point of the room. We've actually got the pool as the focal point for the room. And the way that we're able to enable you to use the pool is because we have wireless waterproof monitoring. For all our electronic monitoring, we have wireless capability actually, and they're all waterproof. But we do make sure that in this room we've got one ready to go, fully charged. And just to show you how it works, we have the two transducers, one to monitor contractions, one for baby's heart rate that sit on your tummy. There's no cables, and we can turn the volume down, and you're free to roam about the room, lie on your beanbag, or get in the pool if you want to. So by all means, you wouldn't necessarily need to have all of these birthing aids in the room, but this is really just to show you a bit of selection of what we have to offer. So we've got the birthing stool here. We have the traditional birthing balls. We've got the peanut balls, which are particularly useful for those times in labour when you do want to just crash on the bed, but actually keep a more active position. And it's shown that left lateral positions with a wide pelvis actually gives the baby a lot more space to move down through the birth canal. Lovely beanbag floor mats with the full wooden cots here ready to go for babies. And what lots of couples do, we find, is actually bring some of the fairy lights that you can get at Christmas time and spread them around the room as well. The lighting display we have in here, the whole room has dimmable lighting, and the light display we have over the pool has a whole range of colours that you can choose from as well. I've got it set on rainbow mode at the moment, so it will go through the whole spectrum of colours for you here. And we have underwater lighting for the pool as well here. So facilities in this room, so we obviously you could use the pool for pain relief, we have the gas and air, and just for safety reasons, obviously in any birthing environment we need to have suction and oxygen should that be needed. But that's really conveniently tucked away in this cupboard here. But we're able to grab that for you whenever needed, and it's just kept nice and tidy here, just so it looks a bit less clinical, really. So we do have another element, I suppose. We have a lovely ensuite that I'll show you. But before we leave this room, I'll just show you that actually it's bright daylight outside at the moment, but because we've got the blackout blinds here, you get a really lovely, dark, cosy feel about the room. And actually we can get it darker, but we've got a wonderful air conditioning unit in use at the moment, and the piping does have to go out the window, so it is letting in a little bit of light. But you kind of get an overall picture for how we can get the room lovely and dark and cosy. So this is the pool room up here on delivery unit. I'll show you the ensuite now. So we've got a lovely big bathroom as well, and this is for you and your birthing partner to use throughout your stay as well. So you get complete privacy and dignity here. So just to recap on some of the reasons why you might be the kind of people that's suitable to use the pool room, that would be people such as people who've had one previous cesarean section, people who may have had some episodes of reduced movements in their pregnancy, people who've been induced. Do talk to your midwife. So if you've been recommended to birth up here on delivery unit, but you are planning to be on the birth centre or at home, do talk to your community midwife about the possibility of using the pool room, and she can talk to you about your options. But I hope this helps give you a better picture for what our room has to offer. Okay, bye for now.